share a video um, that has, let's see, hold on one second, a quick video that we did as part of Homelessness Awareness Month. And we'll just start it out so you can get some context for what we're going to talk about. So let me just make this bigger and I'm going to make it play. There we go.
Many people think homelessness could never happen to them, or that it's the result of bad choices. But the truth is, homelessness is often just one crisis away. Behind every story of homelessness is a moment when everything changed. A lost job, rent increases, medical bills, domestic violence, untreated illness. These are the real reasons people lose their homes. It's not about character, it's about crisis. In Contra Costa alone, more than 14,000 people turned to homeless services last year. Most never imagined it could happen to them. Take Sylvia. After her mom passed away, she ended up living in her van with her dogs. With help from outreach teams, shelters, and housing programs, she finally got her own apartment again and just baked her first cake at home in years. Or Marco. He spent years living in an encampment in Richmond, struggling with addiction. When his baby was taken from his care, he made the choice to get sober. Today, clean for 18 months, he's reunited with his child and living in stable housing thanks to community support. And Ruth, a 21-year-old from Alamo. Rejected by family for their identity, Ruth found help through our homeless system of care. Now, they're safely housed, thriving in school, and dreaming of their future. Housing is transformational. When people finally have a safe place to land, everything starts to change. Healing starts with a door. Housing gives families the power to rebuild. Respect builds trust, and trust builds success. Housing is hope. Housing is healing. A home can change everything. Homelessness isn't inevitable. It's solvable, but it takes all of us. Get informed, get involved, advocate. Together, we can make change.
Great. So for folks who just joined, you might be wondering, what the heck? So we just shared a quick video that was part of Homelessness Awareness Month last year. So just to get a taste of what's happening in the county. And there were a couple new folks that joined, Renee and Rhonda. We did introductions where folks introduced themselves by their name, any affiliation they wanted to share, and then any specific questions you might have or things that you were hoping to get tonight. So Renee, I'll start with you. You able to unmute?
Oh, hi. If I
Hi.
apologize, I'm off camera.
No, that's
I
fine.
just, yes, my name is Renee Ramcharitar, and excuse me, I do work for an organization called Peers in Oakland,
Mm-hmm.
but in terms of challenges with being unhoused, I have lived experience, and
Mm-hmm.
I just have a soft spot in my heart for, um, yeah, I mean, just the politics, the
Mm-hmm.
finances, like so many things involved with
Yeah.
being unhoused. Yes.
Absolutely. Well, I'm really glad you're here. And if you have any specific questions as we go, feel free to drop them in the chat or do your raise hand feature.
Thank you.
Yeah. Rhonda, how about you? Okay. Oh, one thing I want to do is put on the transcript in case people want to show the transcripts. I mean, the live captions in case people want to see them. Okay, so I am actually going to move into, I have a PowerPoint that I'm going to use. And, oh, I have so many things open. Hold on one second. All right, let me move this. Sorry, this is always the hardest part of things. All right. Can you all see the PowerPoint? Oh, Mercedes is here.
Yes.
Okay, great. Thank you. I realized I can't see your faces, so I have too many screens and not enough information. So I am going to, let me see if I can do it this way. There we go. I'm going to put this over here. Okay, here we go. So what I'm going to cover tonight is a little bit about data, and then I'm going to talk about this thing that's the homeless continuum of care. And that's a very specific term that people may or may not be familiar with. So I wanted to just talk about it because you're going to hear that as you start to learn more about our system. I'll talk about the services that are available and how to connect, some of the local things that are happening, and then how to get more information. So I showed you the video. So in terms of data, I want to start by talking about where do we get our data? Where do we get information about what's happening in homelessness in Contra Costa? So some people may have heard of this thing called the pit count or point in time count. So that's the more well-known way that we get data. It's a once a year, one day. We just literally that icon, for those of you that are younger, might be like, I don't know what that is. That's a camera. So you take it sort of a snapshot of just one night of everyone we can see or observe that's homeless on that one night. It's not a great way to tell you what's happening in our whole community, but it is the data that the federal government uses to decide how much money we get compared to how much money Alameda gets, for example. It allows them to compare apples to apples. If you want to see what's actually happening in our community, then you actually would want to use what's called our HMIS data. And that is a fancy way of saying that's like our database of like as people are getting services throughout the year, there's data that's getting entered into this big database. I want to double check. Are there two little boxes that are covering the screen, or can you guys see the whole slide by itself? I just want to make sure I'm not blocking it with some of the. Are we good?
There's, yeah, a couple boxes
Okay, and I'm
covering
gonna.
the.
Okay, thank you. I just wanted to double check. I never know with this. Okay, great. Um, okay. And Mercedes, you're welcome to introduce yourself if you want to. We did introductions earlier on. Anything you want to share,
Oh,
your name, any affiliation, anything you're hoping
no,
for?
thank you. Yeah, I introduced myself earlier. I got disconnected
Oh,
and
got
then
it. Okay, great.
reconnected. Yeah.
Thank you. Got you. Okay.
Thank you.
All right. Oops, sorry. I did not mean to ask you to unmute. Okay. So big picture when we're thinking about data, and kind of the overall what's going on. What we know is that housing is really expensive in California and especially in the Bay Area, and that's a really big deal because we know that housing is actually the biggest factor in a community's rate of homelessness. So we've done analysis to compare Mississippi with California, and what we've seen is Mississippi has rates of mental illness and substance use that are higher and poverty that are higher than California. And those are kind of the things that people say like causes homelessness. What we see when we compare California to Mississippi is that they have higher rates of all of those things, but our rate of homelessness in California is 10 times what it is in Mississippi. And that's because when something happens, when somebody has a substance use disorder or they lose their job or their partner dies or whatever happens that triggers a crisis, in Mississippi, the gap between what they have and what's needed to make rent is not as huge as it is around here. So bad things are still happening, but they're not resulting in homelessness in the same way. Around here, there's been analysis done, and they change this number every year, that you need to make over $45 an hour just to afford a two-bedroom apartment in Contra Costa. So, as I say, if you have two adults working each two full-time minimum wage jobs, they're barely scraping by. So that's why we're seeing a lot of folks that are struggling with housing. And then in 2024, we don't have our 2025 data yet, but in 2024, we saw about over 14,000 people that accessed some type of homeless service in our county, and that was a 40% increase since 2020. So we can also look at this annual data another way. So One way, sometimes when folks look at the overall data and they're like, I don't understand the difference between a household and people. For example, me and my wife and our son are one household, but we would be counted as three individual peoples, and single individuals would be counted as a household. You can see the increases by age group. And so for the minors, that's people under 18. What we know in Contra Costa is we have very few what are called unaccompanied minors, right? So like young people under 18 who are homeless, living on their own. We don't have very many. So that number is really mostly children and families with a guardian. At the other end of the age spectrum, you can also, oh, sorry, TAY is transition aged youth. So that's like 18 to 25-year-olds. And then if you look at the older end of things, we really see a sharp increase in older adults over the age of 65. And that is in large part just that boomers, baby boomers are a big chunk of our population, but also they tend to be very sensitive if there is they aren't able to make up more income, for example, if their rent goes up or they lose some income in some other way. Then if we look at racial inequities, what this is telling us is this is about people experiencing homelessness, like who is showing up to the front door of the homeless system of care. And it's showing that people that identify with as having multiple races or that are Black or African American are experiencing homelessness way, way more than you would expect if everything were equal. And what I always say when I show this data is like when you see gaps that big, uh, that really tells you there's a systems issue, right? This is not about like this group of people making bad choices or whatever the narrative is. This is really like the downstream impact of all the things we know about that drive inequities. And we see that as people show up at our front door. What I will say is we can look at what happens once people start accessing services and kind of moving through our system. And what we see is that things are really equalized in terms of like who's getting services and who's getting housing. In our system, we're treating people equitably, but you can see it in who's showing up. And then in terms of disability, this is probably not a surprise, but a lot of folks experiencing homelessness have some sort of disability and typically have more than one, and often have more than one combined. I'll pause there real quick. Are there any questions about the data piece? And I'll say if there are data nerds in the group, which yay, we have a very long, detailed annual report that I can share. We just are doing kind of a snack on data here. I'm going to pause for a minute and see if there's any questions. Okay. So I want to talk about this thing called a homeless continuum of care. It's also called a COC. So if you get emails from me or from our system, you're going to see this language COC a lot. I'm like, what does that mean? That's a very specific term that the federal government uses to describe the funding program. So we'll start way big picture. So the biggest funder of homeless housing and services is the federal government and specifically the Department of Housing and Urban Development. And they fund a whole bunch of stuff. And they kind of fund them in these different silos or these different buckets. And so one of the programs they have is called the Continuum of Care. And that is money and that is available to fund only homeless related things. So basically they say, we'll give you this money, but you can only, we're going to tell you what the boundary is of who you can and can't serve. So the way that they're defining homelessness for this funding is their language is like people in places not fit for human habitation, which basically means there's no electricity, there's no plumbing, there's no heating. So you're like living outside, you're living in a car. Maybe you're living in an RV, but not like a cushy one hooked up to, utilities, like you're on a back street somewhere, in an abandoned building, maybe in a garage, but not like, you fixed up your in-law, the garage really nice for your mother-in-law and she can live there. It's like you're sleeping with, no access to a bathroom, that kind of thing. So that's who this bucket of money is for. And they say, okay, if you guys want to get this money, this is across the country, they say you have to build this special kind of a bucket that we can pour the money into. And that bucket you're going to call a continuum of care. And it has to have, excuse me, a defined geographic boundary, which means they say you again have to make decisions about kind of who's in and who's out because our funding is based on a certain population. So around here, it's every county has their own continuum of care. In more rural places, like I think the state of Wyoming, their entire state might be one continuum of care, but around here, Contra Costa has one, Alameda has one, San Joaquin County has their own continuum of care. They have this thing I'm describing is set up basically the same way. So each continuum of care has to have an identified lead agency that's kind of like the conductor for everything that's happening. So in our community, that's actually part of my team at the health department. They also say you have to have this special kind of data system because we're going to give you money and we want you to tell us what's happening with that money. How many people are you serving? What needs do they have? What did you give them? How long did it take them to get housed? All that kind of stuff. Then they say you have to have a governing board or a group of people that are helping make decisions about what's happening at the system level. So in our community, that governing board is actually also an advisory board to the Board of Supervisors, and it's called the Council on Homelessness. So if you've ever heard that, kind of wondered, like, what is this Council on Homelessness thing? That's what it is. And then the last thing they say is, okay, we're going to give you money for services. We're going to tell you basically you can't just give this money and these programs and these services out willy-nilly. It can't just be first come, first serve, or like, like I'm gonna give my cousin services before I give it to that guy over there. That's not how it works. It kind of used to in a lot of places. But they say you have to have a very coordinated way of making sure people come in, you figure out what they need, and then you get the most vulnerable people resources first. So that's shorthand for coordinated entry. And I'm going to talk more about that, but this is just like real big picture. So I'll pause. Are there any questions about this big picture structure thing?
Yes. Could you tell me again the definition of the
Of
go
homeless?
back the council on
Oh,
homelessness, and then before that, a little before
sure.
that?
For
Okay.
sure. And I'll say I'm gonna send out the slide deck to everyone that's attending. So you will have all this. If you're furiously taking notes, I will be able to give you the slide deck. Um, so HMIS is our data system. And then the governing board is called the Council on Homelessness. And it is also an advisory board to our county board of supervisors. So everybody on that board is actually appointed by the board of supervisors. And my department also staffs that and helps support that group of people. And if you're interested in the council, I can
Okay.
absolutely get you more information about that. Does that help you,
Okay.
Mercedes?
Yeah. Yeah. Thank
Yeah.
you.
Okay. Um, So another way to look at this, and one thing I'll say, I said HUD or the federal government is the biggest funder, but they're not the only funder. So we get money from the state, and a lot of places get money through the state or maybe the county and whatever. But all those entities that are funding things, they typically say, we're just gonna like have you use the same structure that you're using for that federal funding, and they'll sometimes use the same requirements and that kind of stuff. Everybody knows the federal government is sort of the biggest funder and they set the structure. And so everybody just ends up kind of using that same structure I just described for any other funding sources coming in, or for homelessness specifically. So this is just like another way to look at things. So there's kind of this leadership piece. And then that yellow bar is the different kinds, these are all the different kinds of services that might be provided. And when I first started about 11 years ago in homeless services, we talked a lot about things by like which agency was around. So, it'd be like, here's our list of all the agencies. And what we've realized as a country is like, that's not really helpful because then you have to keep track of like which agency does which thing, and everybody had resource lists and all this stuff. And we've moved to, and you're going to hear in a minute, like we have these three access points. And from there, people are going to be assessed and then connected to whatever services are appropriate and available. So, in terms of these kinds of services that are available, we have prevention on the left-hand side, which is kind of like people that are at risk of becoming homeless. Maybe they've gotten an eviction notice, maybe they have fallen behind on their rent. They're not homeless yet, and maybe there's just some like one-time or light touch intervention that could help keep them housed. We want that, right? We do not want people becoming homeless. But typically the cutoff is like they have to be within 2 weeks of becoming homeless. So I often get people that are like, my rent's too expensive and I really need to move. Like, can you help me find a cheaper place? That's not really what this system is for. This is for people that are like about to get kicked out or lose their housing. And then you go through, and we're going to talk more about some of these. Then we have like outreach for people that are unsheltered, and then we get into kind of shelters, and then these different kinds of housing programs. And there are a number of different providers that provide these services, and sometimes multiple providers are offering the same thing. And as H3, as the Health, Housing, and Homeless Services, people often think like, well, H3 is the whole system, like that we are the only service provider, and we are not. We are one of many providers in our community. So we have two roles. We have part of the team that I'm on has this kind of administrative oversight role for the whole system. And then there's a whole nother chunk of people who are running shelter, running the outreach programs, running some housing programs in collaboration with other agencies. And then we have providers, sorry, partners. So that those are like entities, groups, agencies, people that are working in areas where homelessness is not the thing that they're like paid to do. That's not their sole mission, but they have a lot of people that they're working with that are also experiencing homelessness. So they have some skin in this game. Sometimes they'll have their own funding for homeless services or they're tight partners. And then we have stakeholders. So, like a lot of you are stakeholders, right? Maybe you're an interested community member, or you're with a community organization, cities, other county departments. So, all of these players help make up the COC. Um, so, another analogy that I use is we used to, when I first started, we had all these different providers and everybody was doing their great work, but they were kind of like in with these little blinders on. They weren't really like seeing or collaborating super well with other agencies, and you'd get bounced around. And so what we've really moved to in our system and across the country is, we have all these service providers that are offering services, and I kind of think about them as the orchestra, right? They're all the musicians. We have a conductor on the other end who is like trying to make sure everyone's coordinated. And we're trying to get everybody playing the same song, which is like our focus in our system is really about housing and homelessness. So people may have a lot of other needs, and we're going to connect them to other people who specialize in that, right? So maybe people have substance use disorders, or they're struggling with addiction. We're not getting funded to help them get clean and sober, but we are funded to help them get connected to those services, especially as it helps them hold on to or get their housing, for example. So that's just like another way to look at it. Okay, so I'm going to pause there before I start talking. I'm going to show you actually how to connect to services and then what you might be able to connect to. But are there questions before I move into that? Okay. So in our county, there are three ways to connect to services. It does not always look like this. So I live actually in Oakland. Alameda County has way more options than this, right? They have a whole bunch of different places. In Contra Costa, we have three ways that people can connect. So the first is you can call 211, literally like dialing 911 on your phone, but it's 211. And there is also an 800 number if you don't have access for some reason. The thing about 211 is they are not magically going to solve somebody's homelessness. But what they are going to do is A, answer the phone. You can talk to a live person 24 hours a day. They're going to ask somebody a series of questions to try and figure out, just like if you walked into the ER, they need to know what's going on and figure out like what's the most urgent issue that you have, and then figure out the best next steps. So when you first walk into the ER, they're not necessarily going to solve all your problems. They're going to ask you some questions and figure out like what's going on so you can come up with sort of a treatment plan or come up with a plan for what's going to happen next. So they might identify, you have two really urgent issues, and they might figure out like, here's one agency for this issue that you should start with and one agency for this other one, instead of like, here's a list of 20 agencies that all kind of like work on homelessness. Good luck. So they're going to help simplify things. And they also are that access point if somebody is in need of prevention services. They are actually funded to do that screening and connect people in with prevention services, which I'll talk about prevention in a minute. Um, the second way to connect to services is to physically walk into something called a care center. So we have two. One is in Richmond, that's called the Greater Richmond Interfaith Program, or GRIP, and one is in Walnut Creek called Trinity Center. So these are like daytime drop-in centers. You can get your basic needs met, like you can get your mail sent there. You can do showers and laundry and food. But the other thing they're going to do is housing-focused case management. So people end up going in there every day, and maybe they're helping people with their employment and get their benefits and get their ID and all those things. Um, they're working with people on moving towards housing. So you'll notice there's a big glaring thing that's missing. We have West County and Central County covered. We don't have a care center in East County. And that's because we don't have any homeless service agencies that already exist out there that we can kind of add on to. So one of the things that we've done is really beefed up our
Jamie,
core mobile outreach. Yeah, go ahead.
real quick, just to add, like
Yeah.
Upward Health is somewhat of an agency that helps with that.
Hmm.
So,
Yes.
okay,
There
Contra.
are a lot of agencies that are helping people with housing and but like we don't have and I'm actually glad you said that. So for example, we have GRIP and Trinity Center that are official care centers, and that means that they are funded to do housing focused case management and basic needs. Concord Shelter has a drop-in center that's like part of that complex of buildings. And they're not considered a care center because you can drop in and get a snack and hang out and cool off and get food, but they don't have the staffing to provide that really intensive housing-focused case management. So there are a lot of agencies now that are funded to support with housing, and part of what may happen as through a care center or through our core mobile outreach teams is they might realize, ooh, somebody has Medi-Cal, and we think that there's some benefits that the health plans or these other agencies like Upward Health can help with, and so they'll help connect people.
Okay.
Yeah. And so core mobile outreach, we've really invested a lot in this over the last 8 years. So we now have over 20 outreach teams. So these are teams of two people that are literally out in the field. They are in encampments every day. They are responding to calls about people that, are living unsheltered. They are working, some of them are funded for specific populations. So we have like a reentry for folks that are coming back, reentering the community after being in the criminal justice system. Because you don't want to just like, and this happens, right? People are like, okay, you're done with jail or prison, and like, we're going to release you at 2 in the morning with like, $20, and these people have no place to go. And like, that's not a good setup. So we have outreach teams that are working with the jails to make sure that they get notified when people are getting released. Same things with the hospitals. We have some that work with specific populations like families with children or that sort of thing. And then we have some that are working that are like funded by cities and work just within those cities. And they work closely with like the city police department, not to get people in trouble, but like when people are calling, like, hey, there's a homeless person, fix it. Instead of sending out a police officer, which doesn't really make sense, they would engage a core team who can go out and say, like, hey, what do you need help connecting to? Here are some survival supplies. Let's start working together. Because law enforcement doesn't have any of the tools and resources that folks experiencing homelessness need for the most part, right? That's like not a law enforcement issue, that's a social service issue. So I'll pause there and then I'm going to talk about what kind of services people might connect to, but I want to pause on the like how to connect piece. Are there questions about that?
No.
Okay. Okay, get ready. I call this the octopus. So this is at a very, very high level. If you're looking down at like all the things that somebody might be able to connect to. It doesn't mean that all this stuff is available to everybody, but this is like the full universe of what people might connect to in our system of homeless services. So those yellow arrows are the access points. So on the left-hand side, you see prevention and diversion. So that green swirly thing, that's really for people that are at risk of homelessness, or maybe they just became homeless and there's a way that we can kind of keep them out of the rest of the system. So sometimes, they just need some conflict mediation, conflict resolution. So maybe like I could still live with my mom if we could just stop fighting, but like we just really can't get along and she kicked me out. If there's a way to resolve that conflict, then I have a safe place to live. That's great. Also, maybe somebody has just fallen behind like a month or two on their rent and they're going to get evicted because they owe back rent. But if we could pay for those 2 months and they're back on track, that's actually a really good investment. If they're 6 months behind and they have no job, they're probably not going to be a good candidate. But sometimes people really just need a little bit of support. Then when we get into the blue circles, that's around shelter. And what I'll say is we probably have about 40% of the shelter that we need in our community. So it's really important because, we often hear people saying, well, there's just like homeless people everywhere and they're spilling onto the sidewalk and they're in the trees and they're in the creeks. And like, yeah, because say we have 100 people that are experiencing homelessness. We literally only have beds for 40 of them. So you're going to see part of those other 60 people. Not everybody's visible, but part of why we're seeing more people is like they're not places for people to go. So for shelters right now, like they're really prioritizing the oldest, the sickest, the most vulnerable. So like I would never get into a shelter in Contra Costa as like a middle-aged, healthy person. I would not get a shelter bed. I just wouldn't. It's really going to be the oldest, the most fragile, or we do have a few family shelters. So or if somebody's like pregnant, they might you might get a bed, but we just don't really have enough. And I'll talk about shelters again in a minute. If we go to the teal stuff on the right-hand side, a lot of these services are available to a lot of different folks, regardless of whether or not they're um, currently unsheltered or in shelter. So we have a healthcare for the homeless program at the health department, where they are a mobile healthcare program. They go out into encampments and then they also have clinics. Their focus is providing services for people that are homeless. And that's really important. They understand what's going on and how to work with folks in that kind of a crisis. There are also a number of mobile hygiene programs. So we have, this has been new in the last 10 years. I think there's now 3 different programs that do mobile showers. So they have like a shower truck and they have a schedule. Lots of different food and clothing resources. Safe parking, I'll talk about in a minute. And then the red are the kinds of housing programs that are housing programs specifically for people that are homeless. So you have to be homeless to be eligible for this. And I'll talk a little bit more about how people connect with that. But this is kind of like the big picture universe. And so part of what's happening as people are calling 211 or working with a core outreach team or going to a care center is those staff are trying to figure out what are you eligible, what do you need? And then are you eligible for these different programs? And those staff people are connecting them instead of people just having to like stumble around and try and find help and not know which agency does which thing. So that doesn't, one of the challenges is we have a lot of people that have needs that aren't getting met because even though they're in need, there might just not be enough to go around. And so, one of the things, like as we talk about prioritization, like I said, right? So with our shelters, for example, if I didn't get a shelter bed, it doesn't mean I don't need a shelter bed. I may still really need it, but there are maybe 10 people that are in even worse shape than me that are going to get it first because we have to make decisions like that. But it doesn't mean that people that aren't getting things don't still have needs. And I think sometimes it feels like, well, you don't care about me. No, it's just that there's not enough to go around. So I'll pause there. Are there questions about this, the kinds of services?
No, no.
Okay. I want to talk for just a quick second about shelter. So I dropped it in the chat. There's a link to our Get Help page. And on that page, there are links to two different flyers. One is in English, one is in Spanish. And it talks about our 3 access points. And then the back page is a grid of all of our shelters that will say the name of the shelter, where it is, what population it serves, because some are for adults only, some are for families with children. We have one for transition aged youth, so young adults. And that will also tell you how to connect with them. So as I said, we don't have a lot of shelter, but what we do have, we've done a lot of work across our community to make them better and to make them more appealing. Because for a long time, and it's still like this in some places, shelter was very unappealing for a lot of people. It was like these big rooms with like a bunch of bunk beds, and you have a bunch of like really traumatized, stressed out, potentially people deep in mental health crises, all in one place. Your stuff's getting stolen. Like that does not sound very appealing when you could actually just like be in your tent with your dog in an environment with your friends or the people that you trust. So we've done a lot of work to, when we say non-congregate, for the county shelters, we've basically built what are called sleep stations. So it's really like an office cubicle where somebody now has 4 walls and a door that locks, and they can keep their stuff there. They can have some privacy. It's not like this at all the shelters, but at the county ones. We also no longer, like, we used to just have these random lengths of stay where we arbitrarily just said, and this was true in a lot of places, well, you can stay for 60 days and then you got to get out. And the idea was like we needed to make room for new people to come in, but all we were doing was like destabilizing people. They'd come into shelter and then maybe they were working on housing and we'd be like, well, TikTok, you got to go. And then it's a lot harder to work with people when they're unsheltered. And because it's harder to connect with them, people can't hold on to their paperwork, their documents, their IDs, things get stolen. So we no longer have just like a random length of stay. We're really working on people stay as long as they need to while we're working on their housing. And then one of the other improvements is really to make things more pet friendly. So for a lot of folks, like their animal was like the one source of like love and safety and security and connection. And if they had to choose between coming into a crappy shelter and leaving their pet, there's no contest. So we've worked to really make things more pet friendly. We've gotten grants to build kennels and have vet services come in and have pet carriers and all that stuff. So you obviously can't have like 5 dogs or an elephant, but within reason. People can have pets now in many of our shelters. Then in terms of warming centers, so these, I said, once you're in a shelter, there's no set length of stay, you can stay. Warming centers is kind of like again, if you've ever been to an ER, it's kind of like that triage kind of holding area. So warming centers are like if somebody really needs to come in or be seen, they can they basically stay on a cot. It's not like a full bed with a full space, but they can come in for the night and the staff are going to work with them to really do some intensive problem solving to figure out like, can we get you into shelter? Where can we have you go? But it's like if our core teams are out and they see somebody that's very vulnerable that night, they'll bring them in. There's no guarantee that they'll be able to stay in that bed the next night. So it's not really shelter in that way. And then the last thing that we have is what we call our safe parking program. And so there are folks that are living in cars, so they have to be able, the car has to be running, right? But they can stay in a particular lot that is secured. There's security, they have access to bathrooms and food. Because a lot of folks that are sleeping in their cars are really vulnerable to becoming victims of crime. They get told to move along. They don't have access to bathrooms or food. So that's another kind of an option that people may have. And again, that QR code will take you to a page that has details about all these programs. Okay, I'm going to take a breath. That's a lot of talking. I'm going to pause for a second. Questions about shelter, about the services piece. I'm going to talk about housing and coordinated entry in a minute, but any questions about that sort of crisis response and beginning connection piece?
No.
I have no questions.
Okay, great. So I've used this language a few times, coordinated entry. And all that really means is there needs to be a thoughtful process about how you find people that need help, you figure out what they need, and then you get them what they need. So it used to just be first come, first serve. And that really doesn't work because then the most vulnerable people are just getting left behind every time. So the federal government says across the country, everybody has to do this. You have to have a way that ensures that people know how to connect. So we have those 3 access points. Once they connect, you have to have a way and a process and some tools that quickly identify what they need, how vulnerable they are, and then get them connected to the most appropriate and available resource. And when there's not enough to go around, you have to prioritize the most vulnerable for what's available. So I want to talk through the kinds of housing options that might exist within, this is again, like just talking about homeless services, because you'll hear about affordable housing, and then there's different kinds of like our behavioral health programs sometimes have funding for their own housing that is for people that have a behavioral health disability. But what I'm talking about right now is just for people that are homeless. Maybe they have those other things, but they're trying to get into the housing that is funded just for people that are homeless. This honestly caused me the most confusion for the first couple of years, and I'm going to walk through this, but I'm really happy to answer questions. So I am experiencing homelessness. I get connected to a case manager. Maybe I just have a substance use disorder. I fell off the wagon. I got fired from my job and I got evicted, but I've gotten clean and sober. I have a good paying job now. I just need some help getting back on my feet a little bit. I can pay my own rent. Maybe I just need help, finding a unit or getting, first month's rent, but I can pay my own rent and I don't need any support services. Sometimes we help people do that. Then sometimes we connect people with something that is called a voucher. And I'm going to big red flag. This is where I see the most confusion and where I had the most confusion for years. So, a voucher is a thing that HUD, the federal government, gives to housing authorities across the country. So in Contra Costa, we have the Contra Costa Housing Authority. That's the biggest one. And then there's a little one in Pittsburgh. But let's pretend like we're just talking about the Contra Costa Housing Authority. So what HUD says is, hey, housing authority, we have a couple of different kinds of vouchers that we can give you, and then it's your job to help get those out in the community. So if folks have ever heard of Section 8 or housing choice vouchers, that's what most people know of when they hear about vouchers. So housing choice voucher or Section 8 is a different program than the COC or Continuum of Care. This is where it gets really confusing. The voucher itself basically is a tool to help somebody pay for their rent. So if let's talk about housing choice voucher or Section 8. So if I want to get that, I have to be low income enough to meet the requirements. So HUD says people have to make this amount of money or less to be eligible for this, because this is really just to help people that are poor or low income. If I want to get a housing choice voucher or Section 8, I have to, see that I'm low income enough. And then the housing authority will say, hey, we have a waiting list opening. You hear about a waiting list. They basically say, get in line. I put my name on. They say, oh, okay, you're eligible. You meet the requirements. We're going to put your name on this list. And then what do? I wait and I wait and I wait and I wait. And I may wait 3, 4, 5, 6, 7, 8 years before my name comes up. And then they say, oh, Jamie, okay, are you still low income? You still meet the requirements? Okay, cool. Now I have this thing where they say, okay, go find a landlord that will rent to you, and the rent can only be this particular amount. We won't help if your rent is bigger than this. So you go find a landlord that will rent to you. The housing authority has to come and inspect the property and make sure that it meets their threshold, it meets their standards. And then if the landlord says, cool, I'll rent to you, and my that apartment or whatever passes inspection, then what's going to happen is every month I'm going to pay the landlord 30% of my income, not 30% of the rent. So if I make no money at all, I don't pay anything. If I make $10,000 a year, then 30% of that is going to go to my landlord. It's just help paying for rent. There's no support services attached. There's no case management. It's literally just, that's why I have the little dollars, right? It's just helping pay for rent. Sometimes the housing authority gets vouchers that are for people that are experiencing homelessness. So these people don't have to wait and wait and wait on that. They don't go through that same process. They basically, if the housing authority gets those, they tell our team and say, hey, coordinated entry team, we have some housing vouchers. And that team is going to look at our list of people that have had a housing assessment, that are homeless, that are looking for housing. And they look and see like who's the most vulnerable and who could actually live on their own and who might be a good fit for this. And then we tell the housing authority who can get those vouchers. So the confusion is there's different kinds of programs where some of them you just have to be low income and you wait, but sometimes we get them vouchers that we in our system can assign. So I'm going to pause. Are there questions about the vouchers? Because that causes a lot of confusion. And I get people that are like, hey, how can I get a voucher? Can you get me a voucher? We can't just
Yes,
get people vouchers. Yeah, go ahead.
yes,
Question.
yes, I have a question.
Uh-huh.
So, when you're talking about we, that's not HUD. Is it
Mm,
Shelters Inc.? Who's
great
we?
question. Yes, sorry. I'm really glad you said that. When I say we, I mean the health department. So I work for Health, Housing, and Homeless Services, and we have something that's called a coordinated entry team. And I'm going to talk a little bit more about that in a minute about like how people get prioritized. But essentially, they're holding a list for the whole county of people that are homeless that have had a formal assessment to figure out how vulnerable they are. And it's literally like an Excel list that you can sort by who has the highest score, who's the most vulnerable. And then if there's an opening or there's a voucher, then the coordinated entry team will say, okay, housing authority, here are three people that using all of our tools, we can tell should be prioritized. And you take a look at them and see if they're going to, you know, work for your program. But the house people can't just go to the housing authority and say, hey, I want a voucher. And so, or Shelter Inc. or other, I'll talk about some of these other housing programs. They cannot just fill their housing program slots with people that just come to their door. You have to go through this whole process. And that's different from how it was 10 years ago. Does that help
And
answer your question?
no, not really. I'm
Okay.
confused. This might be a
Okay.
dumb question.
No.
So this is through the Health and Human Services, or
Good
I don't
question.
understand that HHH. I'm really confused. I'm sorry.
No, you're fine. Don't apologize. Okay.
Thank
So,
you.
for Contra Costa County,
Yes.
um, we have a health department that's called Contra Costa Health.
Okay.
And so the county health department has a program that's just focused on housing and homeless services. So that's who I work for is H3, Health, Housing, and Homeless Services.
Oh, okay.
And so we're at the county, but we work with a lot of different partners. So when I'm talking about these vouchers and the housing authority, that's like a different group that
Yes, that's
works. So they get they also get money from HUD, just like we do at the health department, or other programs in our community get money from HUD, but most of their money is just for vouchers, where we get funded to do, you know, um, all sorts of other kinds of services for people experiencing homelessness.
and if
So honestly,
so,
like for people seeking services, what you really need to remember is these three access points. You don't actually need to necessarily know who does what and what agency. Like people used to have to know that. From these 3 points, either calling 211, going to a care center, or connecting with a core team, it's their job to figure out how to help get you what you need. Go ahead. You have a
okay.
question.
Thank you. Just my last question. So
Yeah.
do you have to have, is Medi-Cal part of this? Do you have to have Medi-Cal or be
Good.
part
No,
of the county or
that's a
not?
great question. So, all of these initial, like, so this is called kind of like crisis response. So, anybody can get any of this stuff that I'm showing on the screen right now. Doesn't matter what your immigration status is. You can go to a care center, core teams can start to work with you. Sometimes people are have like benefits in another county, right? Like I just had this today. Somebody's like, my benefits, my CalWorks, whatever, my CalFresh is still in Solano County. I'm trying to figure out how to get it transferred. That's like slightly different. But all of this is available to anyone, basically, regardless of if you have health insurance or whatever. If you have Medi-Cal and you, especially if you're part of the Contra Costa Health Plan, there's a whole bunch of extra stuff that you might be able to get through your health insurance. And there's a couple providers on here that, have some services that they're offering to people that have Medi-Cal. But for this stuff, what I'm showing right here, none of that matters. You can get this kind of emergency response stuff or crisis response, regardless of immigration status, insurance status, all that. Does that does that
Yes,
help answer your question?
it did. Thank you.
Good. I saw a question in the chat. How long can they stay in the shelter? Different shelters have different rules, but for the county shelters, there's not a time limit. Um, that said, like if people can stay in the shelters as long as they're kind of like following the rules and not like being super disruptive or any of the other reasons why any of us might get in trouble somewhere. But there's not like just a random like, okay, time's up, you got to go. Does that answer your question, Felicia? Motel vouchers, that's a really interesting question. So we in our system, we don't really have motel vouchers. That was like during COVID, we had like a hotel program but like that doesn't exist anymore. Sometimes there are motel vouchers through like CalWorks, but for the most part, there aren't a lot of like motel, and sometimes maybe through domestic violence, like Stand for Families Free of Violence, although don't quote me on that, I'm not sure. Um, so motel vouchers are not very common in our community. Um, but to find out about them, that would be where you might want to call 211, and they might be able to tell you more about a particular program that they know of. I saw ER housing. I don't know, say more about ER housing if you can. Okay, I'll keep going and then we'll come back and I'll see. Oops, whoa, sorry. Wow. Okay, so vouchers is one kind. Then these last two are the kinds that are funded by HUD for our community. And I'll just make a note that there's some big changes coming because of things that the federal government's doing. But right now, this is what it looks like. We have funding for something called rapid rehousing. So this is time limited support where somebody is going to get help with their paying their rent, as well as case management services. Hold on. Sorry. Um, rapid rehousing is time limited, and it's basically like I think about it almost like a training wheels on a bicycle, where somebody is going to need support. They're learning, they're going to be riding on their own eventually, but they need some extra support for a little while. But the training wheels are coming off, and they are going to have signed a lease or have a rental agreement. They are, but for a set period of time, they're going to get help with their rent and they're going to get help with case management, have somebody supporting them, but that's going to taper down and eventually that's going to go away. And they know, the landlord knows, everybody knows how long they're going to have it, and there's a like active planning helping get ready for that. So you see there's money plus case management, but it's time limited. And then the last kind of housing that we have in our community that our programs fund is called permanent supportive housing. And this is really like the most effective kind of housing we have. Once people are in this, 98% of the time, people are still housed in a year. It is for people with the highest needs in our community. So to be eligible for this, somebody has to have a documented disability. So it can be physical, it can be mental health, it can be a substance use disorder, but it has to be a documented disability. And they have to have been homeless for basically at least a year. Um, the term that HUD uses is chronically homeless. It has a very specific definition. If somebody gets into this, it's not time limited. They're going to get rental support and supportive services for as long as they're in the program, which may be the end of their lives. So with rapid rehousing, I see that question. Yes, so for rapid rehousing, you typically do have to have some sort of income because you're going to have to pay your own rent once the program ends. So sometimes people might not be a good candidate for rapid rehousing if they have very low income or they aren't working and don't have either the capacity or plans to work. So yes, sometimes people might not be eligible for rapid rehousing if they don't have income because the program's only for a little bit. And then it's basically to get people going, but they have to be able to support themselves. So the last two and some of the vouchers are assigned by coordinated entry. So like, what the heck does that mean? So to determine, say I'm experiencing homelessness, I start working with a core outreach worker and I say, hey, I'm interested in housing. And they're like, cool. They're going to go through a process with me where they're going to get information either from me and or from some different data sources. And we're going to look at my history of housing and homelessness. We're going to look at how many times I've been homeless. Have I been evicted? What does that look like? They're going to look at my income and employment. What resources do I have? What's my history of employment? Have I graduated high school? Do I have a degree? All those things. They're going to look at my disabilities and health. They're going to look at my experiences with services and other systems of care. So, am I like a frequent flyer in the emergency room? Am I getting in trouble with the law a lot, right? Am I getting arrested a lot? Am I in and out of the criminal justice system? Am I experiencing behavioral health crises a lot? They're going to look at all this stuff because all of these things, sorry, the last thing is experiences impacting well-being. So this can be like, do I have a history of childhood abuse or trauma? Have I been trafficked? What are all the different things that may have happened to me that may predict me staying or becoming homeless again or needing extra support? So we look at all this stuff, and even when we're looking at other data systems, we're confirming with people. So like it looks like, okay, it looks like, you've been arrested 5 times. Is that accurate? Is there anything else you want to share about that? So some of these are questions for people with like a kind of survey question, and some of them are data that we have access to that we then confirm with somebody. So based on that, that helps us decide who's the most vulnerable. So the way this looks in coordinated entry, say there is an opening in a rapid rehousing program. I come in through a call, care center, or core. Somebody is going to talk, and I'm interested in housing. Somebody's going to say, great, let's go through this vulnerability assessment. But also, let's talk about what your housing needs are and what your preferences are. So maybe I'm a single mom with 5 kids. A studio is not going to work for me. Or maybe I've been gang affiliated in Richmond and I've gotten out of the life, but like you can't put me back in West County or like we're going to have a problem. That's a really valid preference. So then we have this, there's an opening in a program. So the coordinated entry team that works kind of like over the whole system has all this information. And so they're going to sort this list of people that are really vulnerable, and they're going to see who's the most vulnerable and do we think they're a good fit for this kind of program. And then we'll send those names over to the programs that are running the agencies running these programs. So Shelter Inc., Hope Solutions. We'll say, okay, we have, these folks we're recommending to potentially fill your spots. And then we give them those names. You can't just walk into Hope Solutions or walk into Shelter Inc. and get housing through them. It has to go through this process because this is how we make sure that the most vulnerable people are getting the help that they need. And again, it doesn't mean that if you don't get prioritized that you don't have needs and you're not vulnerable. It just means there's more need than there is housing. Okay, super lot of talking. Happy to go over any of that again. The take home is if you need help, connect with 211, a core team, or a care center, and they will help you navigate through this whole thing. Questions? I'm trying to remember what's after this. Oh, we'll talk about that in a minute. I know this is a lot of information and I'm talking really fast. Oh yeah. Is it expensive to run a shelter and why don't we have more due to an increase of homelessness? Felicia, that is such a good question. Yes, it's actually really expensive to run shelter. So when I started 10 years ago, the estimate was that it would cost about $1 million to run maybe like a 30 to 50 person shelter. That number has gone way up. And one of the things that I often hear and have thought myself before I started working in this, like, what the hell? There's all these empty buildings everywhere. That building would be a great shelter. Why isn't that abandoned building turned into housing? Buying the building is never the issue. That's the easy part. It's figuring out how to get the ongoing funding to run these things that's really hard. And part of the challenge is HUD doesn't pay for shelter. Shelters are cobbled together with like a ton of different little funding sources to make it work. It's really hard to find funding to run shelters. So it's not that there's not a need, it's really an issue of ongoing funding sources. Same thing for housing, right? So we could, like you could buy a building. It's not that hard to like do a big rally and gather a bunch of money to buy a building. That's not the issue. It's like, how are you going to pay for the people to live there year after year after year? So that's really where the challenges come in. So right now, this HUD funding helps pay for people's housing year after year after year. What's happening is the federal government has just made some really big cuts to the funding coming to our community around housing, it's coming to our community to pay for supportive housing. And they basically just said normally we get about $23 million a year from the federal government just in our county. So $23 million, 90% of that we can use to pay for particularly permanent supportive housing and rapid rehousing. What the federal government just told us across the country is you can't use 90% of your house money for that. You can only use 60% of your money for that. The rest of it has to go to some of that crisis stuff in the beginning. So you could use it for outreach, or you could use it for some of that beginning stuff, but not for housing. And the problem with that is that the solution to homelessness is not outreach and it's not shelter. The solution to homelessness is actually housing. So we're really looking at some big impacts over the next year, the next coming years, because of this. So I see the question, what about Measure X? So Measure X, for folks that don't know, there was a ballot measure that was passed number of years ago, where there's a tax where some of that money can go to homeless services and housing. So Measure X is great and it's helping fund some stuff, but it's getting spread out pretty thin. So there's not enough in Measure X to pay for these kinds of housing programs. It can help more with that, like, help funding some shelters and that sort of thing, or some of the prevention services, but it's not enough to sort of fill this gap. It's a really good question. How are we doing on time? Okay, we have about 10 more minutes. Um, I'm gonna skip through some of this, but when I send it to you, actually, one thing I did want to show you is we have been making progress. So I know I've spent a lot of time saying like, we don't have enough stuff. That's true, but we've really been investing in our local community to try and add more capacity. So this was from 2024 to 2026. We had a 24% increase in temporary and permanent housing beds. So that means shelter stuff, but also some of those housing programs. Um, some of that may look different depending on what happens with the federal funding, but this is showing like there are good things happening, and there are improvements being made, and there's still a need. I'm going to skip through some of these, but if you're interested, you can see like investments the county has made, investments different cities are made. What I wanted to move to is, so like you're here because you're interested in what's going on. You want to know more. You've gotten kind of like the appetizer, right? You've gotten like the beginning. Um, I run a mailing list that has a lot of different sub lists that depending on what you're interested in. We have a website that has a lot of information. We have a ton of meetings that are happening. And then we have trainings. And so I'm at the end, you'll see how you can sign up for our mailing list. But I wanted to say, like, you all now are ambassadors. You've learned some information. You can share that information. If you need help, um, figuring out like how to explain things or you need more resources, you can reach out to me. And you also can take action. So you can volunteer. Sometimes folks want to donate. I have a list of agencies. But you also, like, if you have a group where you think it would be useful to have me come and be a speaker to do something similar, because you want them to understand this too, you can reach out to me and I'm happy to help get you connected. This is a little bit about the Council on Homelessness. I'm not going to spend a lot of time on there, but those meetings are open to the public and they are the first Thursday of the month and they're hybrid. So you can attend online or in person in Martinez. Okay, so this is our mailing list. I'm sorry, this is our website. So this is the Get Help button. So you can get the flyers and find out, how to get connected to services. This is for the data nerds where you can get a bunch of data. If you want to go look at past trainings we've had, you can look there. That's a bunch of information about the Council on Homelessness. If you want to know more about how to help or donate, all that information's there. And then this is the frequently asked questions document. And our website, I'll put this in the chat if you want to get it. It's cchealth.org/H3, and that will take you to basically that page. Whew. Okay, so this is my contact information. I'm going to put it in here because you're really invited to reach out to me. And what I'll say is I may not have the answer, but I'm going to help get you the answer. I don't directly connect people in with services. I mostly help people understand our big system of care and get connected wherever we can. I know that was a lot, super fast. I'm going to pause and see if people have questions or want me to go back over anything.
Yes, I have one last question. For the permanent supportive housing, you
Yeah.
mentioned a mental disability from the doctor. So that doesn't specifically mean that you've applied for disability. That's just a certificate from the doctor, or?
Good question. Yeah, so they basically, I don't know exactly what the documentation needs to look like, but they describe it as a documented disability. So you do have to have it verified by a physician, but it doesn't mean that you have to already that you've applied for SSI and you officially have a disability benefits. You just have a documented disability. So it could
Okay.
be physical, it could be it could be that you have debilitating anxiety and depression that keeps you from holding on to housing or work. It could be that you have a substance use disorder. It could be that you have congestive heart failure, right? There's a bunch of different kinds of disabilities. But if you get connected in with a case manager, they can help walk you through with that if you have
Okay.
questions. Yeah, it's a good question. They answer all your questions.